Hello, this is Anudeep, a second year medical student. Can you please confirm your name and age, please?
This is Mandip, age 22.
Okay. Do you have any kind of indigestion
No,
or any kind of nausea
no,
or any kind of abdominal pain?
no.
Okay. Now I'll be performing abdominal examination, which includes palpating your kidneys. Will that be okay with you?
Okay,
Okay, fine. We'll start in a couple of minutes.
thank you.
To start the abdominal examination, firstly ask the patient to empty his bladder and then lower the table and ask the patient to relax and expose the supine patient's lower abdomen. And now inspect for any kind of scars, dilated veins, rashes, and ecchymosis. Inspect the symmetry and contour of abdomen or any bulges. Observe the contour of umbilicus carefully. Look for any kind of abnormalities. And now warm your hand and your stethoscope and hear the bell sounds. By placing the diaphragm of the stet at 4 different quadrants, listen for the different vowel sounds. Listen for the vowel sounds in all the 4 regions, that is right upper quadrant, right lower quadrant, left upper quadrant, and as well as the left lower quadrant. And also listen over the iliac arteries just below the left lower quadrant. And now it's time for percussion. Lightly percuss the abdomen to assess the tympani and dullness. Tympani is a high-pitched musical sound that indicates the space filled by air or gas in the stomach or intestine. Dullness suggests the fluid or underlying organs like the liver and spleen. And now palpate the 4 quadrants of the abdomen, beginning gently and safely. With your fingers together, place your hand flat on the abdomen. Using a light dipping, moving smoothly, palpate all the 4 quadrants, identifying any kind of tenderness or any increased resistance. And now, percuss the span of the liver. Firstly, locate the mid-clavicular line and use the light moderate percussion strike, starting from right below the umbilicus in the right lower quadrant. In area of tympani, percuss up towards the liver. And now, measure the span of the liver dullness between those 2 points with a ruler. Normal liver span is about 6 to 12 centimeters in right and mid clavicular line. For this patient, it is around 8 centimeters. Palpation of liver. For the palpation of the liver, place your left hand behind the lower thorax, lifting up the 11th and the 12th ribs. Place your right hand just below the right upper quadrant lateral to the rectus abdominal muscles, just below the lower border of dullness. Ask the patient to inhale and then press gently into the abdomen, and as the patient breathes deeply, try to feel for the liver edge as it moves down to meet your fingertips. And now try again by moving your fingers closer to the costal margin. This is known as hooking technique, which might be helpful. Standing at the right of the patient's chest place, and also place the fingers of your both hands below the border of the liver dullness and press in and out towards the costal margin by asking the patient to take a deep breath. And now to assess for tenderness when the liver is not palpable, place your left hand flat on the right lower rib cage and gently strike with the ulnar surfaces of your right fist and ask the patient to compare for the other side as well. And now it's time for examination of spleen. For palpating spleen, reach around the patient with your left hand to support the left lower posterior rib cage and place your right hand below the costal margin and press in with your fingers towards the spleen. Ask the patient to take a deep breath try to feel for the spleen as it comes downwards to meet your fingertips. Alternatively, ask the patient to turn somewhat right side with legs somewhat flexed at the hips. In that position, gravity might bring down the spleen, which helps in easy for the palpation. And now, to help detect the splenomegaly, an enlarged spleen, percuss the left lower anterior chest wall, roughly from the border of the cardiac dullness at the sixth rib to anterior axillary line, right down to the costal margin. Now ask the patient to take a deep breath and percuss again. When spleen size is normal, the percussion note is usually remains tympanic. If enlarged spleen means dullness replaced by tympany. Now it's time for examining kidneys. To palpate the left kidney, move to the patient's left side and place your right hand behind just below and parallel to the right 12th rib with your fingertips reaching costovertebral angle. Now lift trying to displace the kidney anteriorly. Place your left hand in left upper quadrant lateral to the rectus muscle. Now ask the patient to take deep breath. At the peak of the inspiration, press your left hand firmly and deeply into the left upper quadrant and then try to capture the kidney between your hands. Now ask the patient to breathe out and hold his breathing slowly. Release the pressure of your left hand and at the same time feel for the kidney to slide back into its expiratory position. If kidney is palpable, assess its size, contour and also the tenderness. And now, palpate the right kidney. For this, move towards the patient's right side and use your left hand to lift up from the back and your right hand to feel deep in right upper quadrant. Repeat the same procedure as you have done it for the left side. And now ask your patient to take a deep breath and ask to slowly let it out. Press the upper abdomen slightly left of midline and feel for the aortic pulsations. And now try to assess the width of aorta. Try to establish its width. Normally it should be less than 3 centimeters. Now ask the patient to sit up and then assess for the costovertebral angle. Place the ball of your left hand and strike with your ulnar surface of your hand. Look for any kind of tenderness in the kidneys. So that completes the entire abdominal examination and everything is fine. Thank you.
Thank you.